All right, folks, we're going to go ahead and get started. This is our weekly Facebook Live with some town updates and COVID-19 updates on the town's response. I'm going to start off with a couple of announcements. Give me a second to get my screen ready here. I don't know if that helped, but I'll get my screen ready. So a couple of different announcements that we want to make. One is about our citizen call center, which we've been letting everyone know about. We've received in a little over 2 weeks of operation over 200 calls for the call center. We have the number right here. 781-352-2363. You can call with any questions, comments, or concerns you have. Our town hall switchboard is still open, but you can also call the call center. We can get you access to town services. We are relaying people to a lot of different social services that are out there, including some of our own. Hi, Jerry Slater. Thanks for logging on. The call center right now is open 8 to 4, Monday through Friday. We're looking to expand those hours in the next few weeks. And just this week, we were able to get a translator service. So if you do know anyone where English is not their first language, we now have access to a translator service that can help translate into over 200 languages. And most of that is done in real time. So once again, Citizen Call Center, 781-352-2363. Callers are standing by. Residents who need help with town services, food assistance, payment assistant resources, guidance on signing up for SNAP, some assistance with unemployment. Call takers are prepared to research your questions and get you help to whatever you need. We are here to help folks, and we will find you an answer and find you a resolution. So that's announcement number one. Announcement number two, I want to talk a moment about the Norwood Fund. As some of you are aware, we launched what we're calling last week the Norwood Fund, and I have a little flyer here. So you can go online to the town's website and you can donate to the Norwood Fund. And I'm going to just talk for a minute about how that works before we start getting to some folks' questions. The town has always maintained some small donation accounts where folks would donate money for a senior or for a veteran or for somebody to have help with their utility bills. It's very little money. There's usually maybe $1,000 or $2,000 in these donation accounts at any given time. So we're asking folks to donate to what we're calling the Norwood Fund, which spreads that money out evenly between these four funds: seniors, veterans, help with utility assistance, and then a food security fund, which allows us to provide some immediate relief to folks in need. We have existing intake processes for all of these funds through the senior center office, through the veterans office, through the manager's office, where we do some triaging and we check to make sure that the claims are valid and we keep track of it. It's all anonymous, of course. You do need to let us know your name and address, but we don't release the information of who receives any assistance. Call the call center if you do need help, and we just that's what we're trying to do with the call center, is find ways to have people get the help they need. But if you can give to the Norwood Fund, we've already had a few $1,000s donated. We need a lot more. The need for help, especially for food insecurity, is huge in the community. So please donate to the Norwood Fund if you can. It's absolutely critical. It allows us to get a lot of wraparound services. It allows us to help people very quickly. If they call us and they say they're out of food and they don't have a payment coming, we can sometimes make sure we get resources to people very quickly. When we don't have those donation funds available, sometimes it takes a lot longer before we can arrange for assistance, or the only items out there are some of the processes or some of the assistance services that take quite a while. Sorry, I will attempt to speak a little bit slower. So the Norwood Fund, you can donate on our website, and you can also mail a check into Town Hall, or you can drop a check off in one of our boxes. If you want to donate cash, we're not taking cash at Town Hall. However, you can go to either the Bank of Canton main branch in Canton or the Norwood Bank branch here in Norwood. They will make a check out to the town of Norwood for your cash amount at no charge to you. They'll also do that if you need to pay any town bill. But if you had cash and you want to donate to the Norwood Fund, that's the best way to do it. And we appreciate our partners at the Norwood Bank and the Bank of Canton for helping us out and helping the community out during this challenging time. I want to talk for a minute about food security and in general what the town is doing and how we're working with the schools and other entities, and also to put a plug in for a couple of programs. First, Norwood Public Schools are doing a family food drive. You can drop off curbside tomorrow, Friday the 17th, from 9 a.m. to noon. So that's bagged or boxed goods dropped off at the high school, door number 7, and this information is going out on our website. What they're looking for, so please just don't go empty your cabinets. We know sometimes folks like to be generous and we get the old can of creamed corn, but what they're looking for specifically are cereal, pasta and sauce, mac and cheese, rice, beans, canned soup, canned fruit and vegetables, tuna, snack items, peanut butter, jelly, pancake mix, Jell-O, pudding, saltine crackers, flour, Ensure Boost, sugar, powder milk, baby food. So there is a list out there. We're trying to get this. We're getting a food pantry set up and run at the high school, starting just for school families. It'll then expand to seniors and then the community as a whole. The Norwood Food Pantry is still operating. We're working with them to expand our capacity to get more food out to folks, starting with school families, because there's a huge need for food in the community. Food security is a big challenge, not just in Norwood, but everywhere. The job loss that we've seen in the community and throughout the country has been enormous, and it's mostly, as of right now, affecting lower wage workers, retail workers, restaurant workers, and those are folks who can't go a few weeks without a stable paycheck. So it's really taking the legs out of a lot of hardworking individuals, and we need to make sure we're doing everything we can do. This is one avenue we're taking. A great team led by Carrie McCarthy and Bernie Cooper in my office, Jerry Miller, Katie Neal Rizzo from the community, and Teresa Stewart and a few other folks have effectively set up a second food pantry in a 2-week food time frame, and it's been incredible. The school district will be releasing information about folks with kids in the district to pick up food. The pickup will be Wednesday, 4/22. There's more information on our website. We've posted a link in the comments, so we encourage you to donate and take advantage of the service if you need it. I next want to talk about the school's grab-and-go meals before we get to some questions. I know there's some folks in there who have sent us some questions ahead of time. We've got some good ones. Anyone 18 years of age and under can stop by for grab-and-go meals from 11 to 1 at the Balch, the Callahan, the Cleveland, the Oldham, and the Prescott. Breakfast and lunch meals will be bagged and ready for grab-and-go service. All teens and children 18 years of age and younger are eligible to get a free meal from the listed sites and take it with them for off-site consumption. I want to be clear, this is not just for students in the Norwood Public Schools. It is anyone 18 years of age and under in the community. So if you're a student or you have kids and you go to St. Catherine's, if you are homeschooled, if you go to some other private school, it applies to you. So please take advantage of it. The schools are also doing a evening or family meal program for each of the 3 Wednesdays in April. I believe they served 250 family style meals yesterday. They're continuing that the next couple of Wednesdays in April, and we're in discussions to continue that into May. It's a chance for families to get a family-style meal in addition to the students getting their lunch to try to help out with that food security issue. I've heard so far it's been very successful. Kudos to the Eli, who is the head of food services for the Eli Norris for the Norwood Public Schools, for getting this up and running, and we're thrilled for it. We're looking for resources. Again, donating to the Norwood Fund helps, but this is something that the town is going to take on and make sure we're paying for to make sure we can provide families with food in their time of need. So kudos to our food service workers who, again, with a maybe 2-week time frame, figured out how to all of a sudden start doing hundreds of family-style meals. After doing breakfast and school lunch for decades, they've managed to ramp up in just a short period of time. So kudos to them. It's another element that we're looking at to try to help with the food security issue that we're facing in the community. So before I go on to some of the questions I had, and we'll keep taking questions, does anyone have any questions or comments about the food security issues or the Norwood Fund or the Citizen Call Center? All right. So starting off with a couple of the quicker questions that we got in the last week or so, a lot of folks have been emailing in and sending questions in. Somebody did ask, how often does the town's emergency management team meet? So that's our incident command team established according to emergency management protocols. It's myself, Bernie Cooper, Kathy Carney from my office, and then Sigal Reese, our health director, and Stacy Lane, our assistant health director. We actually meet every morning, 6 days a week. We're constantly in contact with each other. We meet digitally. So, occasionally a cat runs across the keyboard or a dog pops into the picture. So we've all gotten to know everyone's pet names, and we've all gotten to know everyone's kids' names, because we meet every morning for about an hour. And then sometimes we'll have subsequent meetings as a team throughout the day as needed. We try to take Sunday off, but what ends up happening is we say we're not going to meet Sunday morning, and then 18 calls and 400 group texts later, we didn't meet, but we spent the same amount of time actually communicating with each other. But it's every day. So until the state of emergency is removed or taken out by the governor, we're going to continue to meet every single day and discuss the emergency and the crisis and our response. And that's in addition to all the other emergency management related meetings that we have. There's a food security team that meets regularly. Public health and EMS meet with the hospital 3 times a week. We have staff assigned to work with nursing homes. We have staff assigned working with grocery stores. We have staff assigned on logistics and resources, making sure we're procuring enough masks for staff and for some of the needier folks in the community. So the communication is constant. I know that for the health department, 100% of their time is spent on COVID-related activities. For the rest of the emergency management team, myself, Bernie Cooper, Kathy Carney, 85 plus to 90% of our day is spent on COVID-related items. So we're all putting about as much time as we can humanly put into it, and I'm grateful for them and for their time and their dedication as a team. We did get a question, too, about the state-released case numbers on Wednesday And I believe as of their number released, Norwood was in the low 200s, low to mid 200s. And somebody said, why was our number on our website different from the state's number? And that's actually a pretty simple explanation. The state's number was as of the prior day. So that was as of Tuesday of this week. Our number that we posted last Friday was the number as of the day before, which was Thursday. So that's why there was a difference between the numbers that we had on as of Friday and what the state presented as of Wednesday. And one of the things our team discussed this morning is we're actually going to just start going with that state release of information every week. We had begun releasing our information on Fridays. We have to manually calculate that information. So we figure if the state's willing to do it for us, it's one less item that we have to take care of. So we're happy to have the state actually do that for us, because it is a manual process where the public health staff have to go in and manually count the cases that have come in through the system that they use and then tally it up. So they've been keeping track and committed to doing it once a week. But now that the state's going to go in and pull that data, it's one less item for the public health department to have to worry about. So that information will get released every Wednesday. We'll link to the state's website. If for some reason they don't release it, we'll make sure we go in and do a count and get that number out to everyone. And that actually leads into the next question, which is a little bit bigger of a discussion on our numbers overall in Norwood. Excuse me, this is not a plug, but the Honeydew in Norwood at the top of Subway Hill rarely has a line like you've seen at some other institutions. And it's a locally owned business. So I guess that is a plug for a locally owned business. So shop small. So Norwood's case count, if you look at the percentages that the state put out a number per 100,000, it certainly seems high. And there's a couple of reasons for that. I think we're in the top 10 if you were to look at that percentage. So two of the minor contributing factors. One is we are denser than a lot of other communities in the Commonwealth. Most federal and state programs consider Norwood to be a urbanized community just based on the number of people we have for our size. We have 30,000 residents in just 10 square miles. Now, if you compare that to the town of Plymouth, Massachusetts, Plymouth has about 55,000 people spread out over 134 square miles. I used to serve the city of Caribou as their assistant city manager. They had 7,800 people spread out over 80 square miles. So we are a fairly dense community. A lot of the trends in COVID cases also tend to go along with socioeconomics. So you do see in communities where you generally have a higher concentration of lower incomes, you see a higher concentration of COVID cases. Now, that's partially because of density, and the theory out there is also that a lot of these lower income families are generally lower wage workers who are still having to go to work. So they're still having to report. A lot of them are CNAs, a lot of them are grocery store workers and other essential workers who are still going to work. They don't always have the luxury of working from home. So that's why those trends generally go with that. And we do have some pockets of lower income families throughout the community, more so than any of our surrounding communities. Norwood's wealth distribution is a little strange. It's a little bit more broad than most communities. Those are some of the minor reasons, but there's really two major reasons why our number is higher than other comparable communities. And it's a rather unfortunate reason, but it has to do with the prevalence of nursing homes and assisted living facilities in town. I think as everyone's seen, we were devastated a few weeks ago to hear about the number of deaths at the Charwell nursing home. And unfortunately, that has replicated itself at nursing homes throughout the Commonwealth. There is a high level of COVID activity at virtually every nursing home in the Commonwealth and throughout the country. And unfortunately, it's a susceptible population and it's a captive population. So just like anyone else who is, if you had 50, 60, 70 people living in a building together, you're likely to see a higher spread there. And I think that's unfortunate. I think that's tragic. It's the nature of what a nursing home is, that folks are somewhat living in a congregate fashion. We have 4 nursing homes and 6 assisted living facilities. The total bed count, so that's the total number of residents that they can hold, and they're usually close to capacity, but for all of our facilities in Norwood is 665 beds. So we have 665 assisted living and nursing beds in the town of Norwood. That's not counting the hospital's short-term care facility. So a large portion of our cases are unfortunately Norwood are at nursing homes or assisted living facilities. And that's unfortunate, but you're seeing that in a lot of other communities where they have a high percentage of nursing homes and nursing beds. So that's unfortunate news. If those 4 nursing homes had been one town over, we know that our number would have been quite a bit lower. And that one town over, whether it's Canton or Westwood or Dedham or Sharon or Foxborough, their number would have been correspondingly higher, because folks at a nursing home are considered to be living in the town that the nursing home is in. And in some cases in an assisted living, that's the truth. I had a great aunt of mine, actually, she passed away about a year ago. She, her last couple of months were at a nursing home in Norwood. She lived into her mid-90s, 50 years in Boston and 40 some odd years in Somerville. And her last couple of months were here in Norwood. I was grateful for that. I was able to spend time with her, but that counted as somebody who passed away in Norwood. So anyone passing away at a nursing home counts in as part of that town's count, as well as the testing positive counts here, even though they may have lived 90 some odd years somewhere else. They're considered a resident of the community where the nursing home is. So 665 beds is higher than average for most communities by quite a bit for nursing facilities. But there's another reason we're convinced our number is a little bit higher, and it actually has to do with the great work that our health department has done and our local partners. So one of the other correlations between the number of folks testing positive and is the availability of testing. And we know that nationwide, and everyone's been saying that as the number of tests go up, obviously more people are going to test positive, but the prevalence and the availability of testing is part of that as well. I actually believe I have the dubious distinction of being the first person tested for COVID-19 at Norwood Hospital, but that was back on March 6th. So if you think about it, before any bars were closed, before any restaurants were closed, before people were being ordered to work from home, before a lot of this happened, Norwood Hospital was doing testing. And urgent care in Norwood was doing testing as well. So we have two great facilities in town that have been doing testing now for 5 weeks. So before you had these large centers ramping up, we were doing a lot of testing in Norwood, going back quite a ways. So our health department also takes a different approach with our contact tracing than I suppose most communities take the same approach. We're well-resourced and we're laser focused on that contact tracing. And I'm going to talk about that for a minute and why it relates to our higher numbers. There are some communities, from my understanding, who, when somebody tests positive for COVID-19, what happens is we have to go right into doing that contact tracing. So God forbid I test positive for COVID-19. I did. I was lucky. Right away, the health department contacts me and lets me know that I need to be home. I need to quarantine. We offer people wraparound services. We make sure they have food, access to what they need. We make sure they're taken care of. And we start that intake process of where have you been the last few days? Who have you been in contact with? What was the level of contact? We gather all that information. Then we have to contact each of those people and tell them you need to self-quarantine for 14 days, or we need to interview them and find out what was their level of interaction and did it rise to the level of quarantining or not quarantining. We do that in under 24 hours for every case. I've had some of the health staff getting up very early in the morning and working very late at night to make sure they're getting that done. It's my understanding that in some cases in places throughout the Commonwealth, and the reason that the state's trying to help set up a contact tracing center is those folks aren't being reached as soon as possible because it's difficult. It can take up to 30 hours for one case. We've pulled most of the school nurses in to help us with the contact tracing, and we have staff working on it full time to make sure that we get it done right away. By getting it done right away, people are able to get quarantined quicker, they're able to go get tests quicker, and they're able to get positive results quicker. So we're also aggressive about when we recommend somebody should get a test. And I'm actually a perfect example of that. I had the slightest of coughs in front of our public health nurse, and she pointed that thermometer right at me and said, "You coughed, you got to go get a test." I felt fine. I never had a fever throughout the process. I never had a temperature. I had a very slight cough for a few days, but it was, "You've come close, you need to go get tested." We're being very aggressive in asking people to get tested once they've been quarantined or if they've come into contact with somebody. There are some towns that are maybe not as aggressive with it. There are some doctors that are saying, well, if you've come into contact, just stay home for a few days, and if you're fine, you're fine. It's a little bit different everywhere you go, but we have been laser focused on if we think there's a risk, we ask that people go get tested, and we're getting in touch with contacts within 24 hours. So given our density, given our population, given our nursing homes, that number seems high, but it's also because the health department is doing a good job of making sure folks get testing. And we are fortunate that between Norwood Hospital and urgent care, it's generally been very easy to get tests in Norwood. Now, I know there have been times where folks have said, well, I wanted to get a test and I couldn't get one. If it's not ordered by the local health department, it really is still sort of a decision there. Your doctor may recommend it. Some doctors are, some doctors aren't. Staying at home if you're not ill is still the best thing for everyone. So if you are experiencing a cold, you always should stay home and not go out. But our health department is getting the contact tracing done generally within 24 hours. We're getting right on people, and we're very aggressive with asking them their symptoms and whether or not we tell them to go get tested. Now, if we didn't have such great testing facilities in town, it would almost be a moot point. Somebody who might live further from a testing facility isn't going to want to drive 20 or 30 minutes to a testing facility. Even folks living in the city may not want to try to go through the bureaucracy of a a large hospital in the city to get tested. So we've been very aggressive. Again, I use myself as an example. My own public health nurse said, you're not going anywhere without getting tested. You need to go to the hospital and get tested. And so, okay, I'm obviously going to follow the public health officials' guidelines and recommendations. So I was required to get tested as well. So we've taken that approach, and the public health department has been adamant that if we think there's a need to get testing, we're going to suggest you get tested. And that leads to more people getting tested, more people testing positive. But once we know that, we can do more contact tracing, and we can begin to close the loop on contact tracing and close the loop on each little spread of the virus. So kudos to our health department. They have been working nonstop. They've been very aggressive. We're actually down staff. We had somebody retire a couple of months ago. So they're at reduced staff, but they're being incredibly aggressive and incredibly bright about it and getting it done in an incredibly short window, which is absolutely critical to keeping the community healthy and making sure that we're able to get folks testing and get done. Sorry, I might have lost the screen there for a second. Just a second, folks. Sorry about that. So that, in a big nutshell, is why our number was slightly different from the state's number, but why we are seeing our numbers being higher. It is some of the minor outlying issues, density of the community, socioeconomic issues. Huge factor is the prevalence of nursing homes. Again, 4 nursing homes and 2 assisted living facilities in town, totaling 665 beds. And the availability of testing in Norwood has always been fantastic between Norwood Hospital and urgent care. I haven't gotten the number updated recently, but it's in the thousands in terms of the number of tests those 2 facilities have been able to produce. And we have a health department that is absolutely laser focused on that contact tracing, getting everyone quarantined as soon as they can, making sure that people are getting tests. So we have a great relationship with the hospital. When we've called and said this person was in contact, we think they need to get tested, the hospital is making that available. So we're doing everything we can do to take care of our community and the health department. Our hats are off to them. Our hats are off to all the folks who are working on the front lines, but we're particularly lucky with our health department that we have here in Norwood and the great work that they've been doing. So I know I tend to talk quickly. I'll take a pause there and see if there are any questions on the live feed. There may have been. I got to scroll down. Not a question, just a thank you for keeping Norwood running. Well, we appreciate that. Appreciate all the nice comments, folks. I'll see if I can like some of these. But do folks have any questions about those testing procedures or those numbers? Because we can always come back to it. Somebody had asked me a question previously about, again, it relates to the emergency management. Who makes decisions in town related to the crisis? And as I've said, we have our incident command team. And what Norwood did that's a little different than some other communities is public health is often put in the back seat, and it's town managers and fire chiefs and police chiefs all driving the train and saying, well, you guys go do your public health stuff over here and contact your people and we'll drive the train. So we didn't put public health in the back seat. We put public health in the front seat. And myself and Bernie Cooper and the public safety chiefs all agreed we need to have a public health-led response, and that's what we're doing. Our decisions have differed in some cases from other communities, and that's because we're focusing on our public health professionals and making wise public health decisions. And we think it's worked out great for us, and we're going to continue to do that. So kudos to them. Folks, do anyone in the comments have questions? Why social distancing measures need to continue? Great. Appreciate the compliment there, Courtney. Social distancing is going to continue for a while. I know there's a lot of folks who want to know when schools are going to open, when businesses are going to open. If I had the answer for you, I'd give it to you. Practicing social distancing, and incidentally, we're moving to the term physical distancing. And the reason is that's what it really is. Try your best to stay 6 feet away from people, wear your mask, wash your hands. We use the term social distancing, but we actually don't want people to be socially distant from each other. Call people, chat with people. I got a question, is that sound from a newly established temporary fire station? Yes, we have the fire department set up at the old light department headquarters and at the recreation building because we're trying to keep the crew as separate as we can to respond, so that way we don't have a whole crew go down. We run 15 firefighters a shift, give or take, depending on whether or not folks are out for the day and we can staff up. And if we had a positive hit, we may need to quarantine an entire crew. We don't want to lose 25% of the fire crew at any given time, so we have split them up into 3 different stations to be able to respond. So back to the social distancing, physical distancing, try to keep 6 feet away from people, wear your mask when you're out in public, wash your hands, wash your hands, wash your hands, wash your hands. And if you're not feeling well, please stay home. If you find yourself with a couple of questions coming in, I'll get that. in just a minute. Wash your hands. And if you can not get out of your home for some reason, call our call center. We might be able to help you out. We got a question. Why didn't you ask Charwell to test all those who have passed away just because they had other conditions? So there's a couple of answers to that. Nursing homes are actually not regulated by local public health. They all report to the state. So their operations, their testing procedures all report to the state Department of Public Health. So those cases, when they come in, go to the state. We get a number, if you will, but that all gets reported to the state and not the local public health. So we don't have public health authority directly over nursing homes and assisted living facilities. That's all done through the Commonwealth because the state wants to ensure, at least my understanding, that there's uniformity across the board. They have, we've worked with them. We're sharing PPE with them and working with the nursing homes. But in terms of their testing procedures and how they operate, that's all regulated by the Department of Public Health at the state level. And the governor has been having it's a great idea of his. He's been having the National Guard help a lot of these facilities with their testing. In terms of somebody passing away and whether or not they're to be tested, that's a medical decision made either by the Department of Public Health or the facility. We couldn't order or not order them to be able to test folks after they passed away. Question, are all town employees being paid their full wages and receiving their full benefits while they're at home, whether or not they can do their job? The answer is yes. Most of our employees are working remotely. We don't have any employees other than maybe some part-timers who are home and not working. So we're working on rotating shifts and we're ordering people in when needed, and folks are working remotely. We, like a lot of organizations, had to abruptly jump into remote working. In terms of paying the benefits and paying the wages, we're what's known as a direct pay entity for unemployment. So if I were to lay an employee off, the town ends up paying, and this is common for cities and towns throughout Massachusetts, we pay that directly, that 70% of their salary. So if we go to somebody making $1,000 a week and we say, you're going to jump on unemployment, we're still going to end up paying $700 a week for their unemployment until they're able to get back to work. So our savings was actually quite minimal there. Not to mention, for some of our seasonal employees, cafeteria workers who are actually all still working, and some traffic guards, if we actually laid them off, they might be able to collect into the summer, and we may end up paying more in unemployment than we would actually pay for their salaries and not be able to bring them back. So most cities and towns don't pay unemployment insurance. We pay a direct pay. And the main reason is that unemployment insurance number would exceed what we pay by a factor of 5 or 6. We spend about $150,000 a year on unemployment, but if we had to pay that insurance, it would be $600,000 or $700,000 a year. So over a 10-year period, we'd be looking at millions of dollars versus a small amount that we pay. We're also budgeted through the end of the fiscal year. We're going to see some revenue hits, but we've been trending ahead on our revenue, and we've been really relatively conservative in our revenue numbers, but we're budgeted through the end of the year. Are there an employee here or there who can't necessarily do 100% of what they were doing before? I'm sure that's possible. But for those who aren't, there's those of us working more than 40 or 50 hours a week. I'd also be, and I know some towns are starting to do it, I'd be loath to try to lay people off in the middle of a public health emergency when these same employees are the ones responding and continuing to work for us and provide us services. We've also drafted a lot of employees into different areas. Normally we have one person answering the phone here at the town hall. To be able to separate people out, we have multiple people doing that. We've set up our citizen call center, which another quick question I got from somebody is, or I'd seen on social media, is they hope that the call center was local. It's all our employees and 1 or 2 volunteers from a few different boards and committees, and it's all being done digitally. So everyone gets a cell phone and a Chromebook, and we have them set up on Google Drive, and we have one number that the department was able to set up that people call, and they call that number and it rings all the different cell phones. So they're all actually doing it from home. We currently have about 10 or 12 employees doing it, and we're going to add another 10 or 12. So we've had some employees who have been able to, thank you. I think I just got a couple questions brought in. We've had a couple of employees who would normally be reporting to work at their, either working from home or reporting to work at the library or somewhere else. And we've sort of drafted them into the service at the call center. So we've got about a dozen employees doing that. So that's another way that folks are being productive. And staying productive is, they maybe are working from the office 3 days a week and then doing the call center 2 days a week. So we've been able to keep everyone on the payroll, and I think we're going to continue to keep folks on the payroll. I know some school districts have begun layoffs. Our people seem to be busier than anyone. And when you lay somebody off, it's tough to just bring them right back. The schools are trying to do as much remote and distance learning as they can. It's very difficult. I mean, we went to school districts, not just us, this happened all over the Commonwealth, and said, you've you've never prepared for online learning, especially at the elementary age, well, figure out how to do it real quick. And by and large, they've done it real quick. Some towns have cut their cafeteria staff. I got to tell you, our cafeteria staff have been working gangbusters. They're actually working more than they normally do during the school year. I think the last number I heard was over 30,000 meals have been distributed. So they're working harder than ever. The janitors, some of them were trying to balance out their shifts just to keep them from getting sick. If you have two people normally working, we're trying to have one come in for a half day and the other come in for a half day. And I'm sure somebody out there could say, well, they're home for a couple hours. Shouldn't they lose pay for it? I don't think so, because we're trying to protect them. And at any point in time, we may need to call employees back into service. So we've got the DPW working on a rotating schedule. We're still unfortunately having to bring them in quite a bit because they have work to do. But at any time, if there's an emergency, we may have to order them in and call them in. So it's we're trying to balance it, but we're going to take care of our people. These are people serving the town and working under dangerous situations every day. So we're going to continue to take care of them as long as we're able to. It's the same thing with some of the food security measures that we're taking. We're going to utilize every resource we have to make sure we address the food security measures as much as we can. A couple of questions. Do you want people to wear masks if they're outdoors in the downtown business area or other doors where they might pass by people, or is it only when they're indoors? Wear a mask as often as you reasonably can. I know the guidance is if you're driving in your car, don't wear a mask because you're the only one in your car. If you were going into a business, we absolutely recommend you wear a mask. If you're walking outside, it's not a bad idea to walk a mask. It's tough. If you're walking and there's a lot of people around, you should wear a mask. My recommendation is at least have it with you. It depends on your normal walking route. I live on Manhattan Street. It's a little bit busy. If I were to walk on Manhattan Street, I would bring a mask because I know I'm likely to come across a few other folks. If you're walking on a trail, it's never a bad idea, but you can also practice your social distancing. If you can try to stay 6 feet away from people where you can. But my guess is my suggestion is, hey, Chris Joseph, one of our great DPW employees here, he keeps the town operating and keeps us clean and keeps us looking good every day. So thank you, Chris, for your service and for what you do for the town. But my recommendation is absolutely wear your mask when you think you're going to come into contact with somebody. And 9 times out of 10, you're going to come into contact with somebody if you're leaving your house. I was delayed going to CVS a few weeks ago because I had left, realized I didn't have my mask, drove back home, got my mask, and then now I actually keep a mask in a baggie in the car for that specific reason. I did just spill my coffee, but not too bad. So yes, the answer is we absolutely recommend you wear masks when you're out in public. We do ask that folks. Sigal Reese, our health director, just put out a PSA on masks on when to wear them and how to wear them. And I think that's a great PSA. We'll try to get that up on the website. Question here, have you reached out to the food pantry? They've lost many volunteers. The PTO tried to donate food, but they can't or won't taking it. Yes, so we're in regular contact with the food pantry. One of their challenges is they have resources, but it's their ability to scale up to serve a lot more people. That's actually one of the reasons we're setting up sort of a alternate pantry at the high school, starting for school families, and then we'll expand that. They have resources. We're learning from them. We're actually using their same purchasing account, if you will, to get food from the Greater Boston Food Bank for our food pantry, if you will. So we're working hand in hand with them, and we've let them know if they have resources, if they have resource issues, or if they have manpower issues, people power issues, we will absolutely help them out and find a way to either get them volunteers, or we have town staff that could help backfill and make sure that they would be able to operate. It's tough. The Ecumenical Food Pantry is a great organization. They're all volunteers. Nobody there's getting paid. It's nobody's full-time job. Some of the challenges with taking food is twofold. One of them is being able to do it in a way that is safe. And that's why we have a drop-off procedure set up for our alternate food pantry or our secondary food pantry at the high school, that there's a very strict drop-off and pickup procedure. We also want to make sure they're getting items that they need. Sometimes people like to donate. I used to oversee a soup kitchen up in northern Maine, and I remember getting chili packets from Ames department store from 100 years ago. And sometimes you get items that you don't need, and they're worried about their ability to store items and keep items going. So they're going gangbusters. We're in regular communication with them in terms of keeping them resourced and letting them know what they need and helping them out where we can. I got a question here addressed why the public schools aren't necessarily keeping up with scholastically with private schools. The private schools are far enough ahead that they're able to retain April vacation, unlike the public schools. So I will get you a specific answer from the superintendent because it's a bit of a complicated question, but I can tell you in brief, it has to do with what the state's actually told cities and towns and school districts what they can do. They're limited to the number of hours of online instruction they can do in a day. And I know that sounds funny, but it has to do with providing education equitably. So we have a lot of special need students and special ed students in the school department. Every school does in Massachusetts. We're required to provide services to them just like anyone else. And it's not necessarily the easiest thing to do when you have one-on-one instruction, or you have somebody with language barriers or reading comprehension issues or other challenges. And we have to be able to provide them with an education. And private schools don't always have to provide that same education. They can just go full bore generally with what their curriculum is and say, this is what we're doing, and keep up or not keep up. And all of our private schools, especially the ones here in Norwood, are certainly not that harsh, but we have to go at a certain pace by what we're allowed to with DESE, the Department of Elementary and Secondary Education. We also have the challenge of making sure that we're trying to allow for every student to learn and what we're legally allowed to do. I know the schools are pushing out a lot of content. One of the challenges you have is it's easier in some cases at the high school level, but your younger elementary level, parents need to be monitoring their children. It's tough to get a second or a third grader onto Zoom for 6 or 7 hours a day or go to meeting. So I know they're struggling with that. And most public school districts had never prepared to do online or distance learning at the elementary level. But so it's a combination of the sort of uniqueness of the situation that we're in, the rules regarding to DESE, our requirement to provide an equitable education to everyone, and just the inherent challenge of if a student normally has a paraprofessional working one-on-one with them right there to get through a reading problem or a math problem or a language comprehension problem, it's very difficult to do that through digital means. And we're doing it. I know that the speech therapists are meeting with their students. It's just a challenge to be able to go full bore, especially at the elementary level, combined with the requirements that the Department of Elementary and Secondary Ed has put on us to make sure that we're trying to maintain some level of equitable education, because what we're doing online doesn't actually meet the requirement we're supposed to have for providing a proper and adequate and open public education. But we obviously can't do that because of COVID-19. So it's sort of a challenge. My understanding is the state is getting aid from the federal government to help schools in particular. There's usually a number of catch-up programs over the summer. I believe they're looking into whether or not that's something that they could expand to help kids sort of bridge that gap over the summer a little bit better than they are. We know there's going to be a slide in learning as a result of this. If a year ago somebody had stood up and said we need to make sure every elementary student can learn from home in the event that they need to be learning from home for March, April, May, and June, I think everyone would have thought that sounds interesting, but that's never going to happen. Nobody ever envisioned ourselves being in a situation where we would keep the whole school district home. We're also running into a challenge where some parents are able to spend time with their children at home. Others, I have an employee who is an essential employee, still reports to work a couple days a week. Their spouse reports to work a couple days a week. And there's a challenge there about how they spend time with their younger kids, making sure they're getting their schoolwork because they're still having to get to work. So that becomes a challenge as well. Couple quick questions here. With everything going on, great job by the town in the last storm. NLD, DPW, NPD, NFD, awesome job. Absolutely. Kudos to our light department. We had 4 feeders go down at once. And what that means is at one point in time, between 5 p.m. and 9 p.m., there were as many as 5,000 people without power in Norwood. So we went around 5 p.m. before we had any power outages, maybe 4 p.m. To no outages. It ramped up to as much as 5,000. And by about 9 p.m. that night, we had, I think, 2 residential customers and 1 commercial customer out of power. Incredible job by the light department. We deploy at times when the private companies don't deploy, and that's a risk that our linemen take. And they take that risk because they've always believed that the public being without power is an equal or greater safety and health risk to everyone. So they put themselves in harm's way for us all the time, and we're grateful for it. It was a great response. The police and the fire did great, as well as the DPW. We're offering curbside pickup for branches and curbside chipping for branches if you have had a lot of branches. I know I was out on the night of the storm just kicking some larger branches off to the sidewalk. I didn't write down the 2 streets I did it in, so anyone who saw me in my Tahoe with a blue hoodie on throwing branches onto your sidewalk, I do apologize, but call the DPW and they'll get that taken care of. Question or comment here about online school and licensure, economic equity taken into account when providing online school, as well as what's developmentally appropriate regarding screen time. Absolutely, Courtney. It's one thing for a college to offer online courses. I even took an online course as far back as when I was in high school. But doing it at the elementary age is difficult. Doing it when there's economic disparities is difficult. It's quite a challenge to figure out how to do it and try to provide some sort of an education. I think nobody ever envisioned that we would be here where all schools are closed for, it's already been, it feels like it's been a year, but it's been since around the beginning of March or middle of March. Wow, I think it's only been a month since schools have been closed. It feels like it's a lot longer. I know the teachers would rather be in their classrooms with their students, but society is somewhat being upended, and it's a challenge to get it done. You have device availability as of right now is not a problem at the schools, is my understanding from talking to the superintendent and the IT director. But families and economic situations are different. We have a lot of students in every school district does who either have disabilities, and that's a challenge, or they come from a family that doesn't have a lot of resources. And all of a sudden to have to do all that work from home can be challenged. So it's tough. It's a real tough balancing act. And I don't have kids myself, but putting a second grader or a third grader on to go to meeting for 6 hours, I think those of us who are adults don't necessarily like spending 6 or 7 hours on Zoom or GoToMeeting. So you can imagine telling a third grader to do it. I had a conversation with the superintendent this morning actually about this. Somebody who may have reading disabilities, it's very tough for them to get their work done. So it's a challenge. I think a lot of our educators and educators everywhere have responded phenomenally when they've been told to upend an education system that, for all intents and purposes, has operated the same way for a couple hundred years, where students go into a classroom and they learn from a teacher. And now we'll throw that whole model out and figure out how to do it all differently in a couple of days. I think they've done well, and I think they'll continue to do better as society sort of adjusts to it. We try to get as much information out to people. The food pantry, if they need drivers for deliveries, we can also help with that. We've had some staff volunteer to do drivers. Another just quick example of where people are stepping up to the plate. We called in one of our summer interns from last year, Xavier Cullen, and he's working out of the senior center doing grocery shopping for seniors who are homebound and doing meal delivery. And we've actually had some of our special ed van drivers where their students are at home doing meal delivery for seniors and for other homebound individuals in the community. So there's a lot of that happens behind the scenes that you don't really see about where we're reallocating people and pulling a special ed bus driver and saying, well, guess what? Now you're delivering meals to seniors. We've had some of the selectmen volunteer to bring deliveries to folks when they've needed it. Most of these calls are coming to our call center, although the senior center is still a service point. They're not open to the public, but you can also call them as well. So some great questions. I'm sure as Courtney said here, she's watching teachers reinvent the game on a daily basis. I don't know how teachers do it when you've operated one way for so long and then it's quick go and switch it, but I'm sure it'll get better as time goes on and as everyone gets a little bit more familiar with it. I know that one of the main reasons they didn't want to, most school districts wanted to cancel, if you will, the April vacation, other than I think nobody was able to go anywhere, was that they had just really started getting their stride in with the online learning, and they didn't want to lose that. I'll also tell you, I am aware of towns in the state, and I don't have the specific towns, but hearing from parents and others where they've actually provided no online content to their students. And when I was still under my own quarantine, so I was quarantined at home for 21 days. While under that quarantine, I Skyped into one of the high school civics classes to talk to them about emergency preparedness and pandemic response and what was going on. So I know our students were up and running with some of the online learning, at least something, very early on. And unfortunately, my understanding is there's still districts out there that are not providing any services. But it's certainly not an easy time to be an educator. It's not an easy time to be a grocery store worker or a cafeteria worker either, or certainly not a nurse or a CNA or a doctor. I'm going to check the question feed here for just a moment. Folks can keep their questions coming. Did we get enough additional Chromebooks for the younger kids? My understanding is that for everyone we've wanted to provide Chromebooks to, we can, and the school still has a supply. I don't know if they've provided a Chromebook to every single grade. That would be a question for the superintendent. But I know we, at this time, anyone who needs one, they're able to have one. And the town was able to make sure folks who didn't have internet access were able to get it through Norwood Light for the duration of the COVID crisis. When will decision be made about calling an end to the scholastic year and saying the students will return to the classes in person? Jonathan, if I knew the answer to that, I'd be a wealthy man, and I think you would as well. I think the guidance is going to come from the state. My guess, and this is just a guess, it's not based on any factor, anything else, is if schools don't return to session, they'll continue the online learning through the end of the year to try to reduce that loss in gains as much as possible. And I think they're working on some sort of a summer program. I don't know any details about it. It's just my understanding that that may be one way to sort of reduce the gap that students are facing. Whether or not kids will return to the classroom remains to be seen. We're in the midst, I think the governor was very open today when he said we're sort of in the midst of the peak. We don't know how long we're going to be at that peak. It's then going to trail down. And then we've got to have that conversation about how you reopen society and whether or not public schools will be something that get open first, that get open last, remains to be seen. Question, some places are doing something, just a second here, I'm going to scroll back up. Some places are doing something to acknowledge the hospital staff, applause at shift change. Any way we could do something like that from our cars. There are some folks who I know there's been a lot of meal delivery to the hospital. I've done a few myself, which has been fantastic, from folks raising money through the Friends of Norwood Center. There are folks who are holding signs outside of Norwood Hospital, practicing their physical distancing, of course, showing support. I know some communities have done either the clapping at a certain time or a drive past at a certain time. I think if the community was able to arrange something like that, that would be really phenomenal, and I think that'd be a great thing. We can certainly look into that. That would be a great community project. Hi, Yumara, who just joined us. And another question, doctors have said there's not enough tests in place to test people. I know potential patients who have been turned away. Does Norwood have enough tests on hand for people with access to information? And we've been lucky with the number of tests we've been able to get access to through Norwood Hospital and through urgent care in Norwood. The testing, for the most part, you're guaranteed to get a test when public health says you've been quarantined or you've been in contact with somebody. What they have done is limited the tests for folks who just want to get tests. However, they're starting to expand that testing capacity. We've been lucky in Norwood that anyone the public health department has needed to get tested has not been turned away. The state just opened a rapid testing center in Foxborough, and that's for first responders, so police and fire can go get a test, and they've expanded it to grocery workers. They may have expanded it to other essential workers. I'd have to look into that. But the state's expanding that testing capacity. What we don't have in Massachusetts or anywhere else in the country right now that we would really need to fully reopen society is the ability for that sort of on-demand testing that anyone can go anywhere and get a test at any time. There simply wouldn't be enough tests available, as well as the capacity. So we're lucky that the hospital was well prepared and urgent care was well prepared, and they have not had to have a lag in their tests. There's been some time as they've had to open up new testing centers, but Norwood's been particularly lucky with that and getting our folks tested, and folks who have been tested positive, and then through the contact tracing who we need to get tested as well from there if they're showing symptoms. I believe the hospital's testing numbers are starting to come down a little bit, and we think that's probably a good sign. It's a move as you move into the surge. Those cases have already been tested and come positive, but now that the Foxborough Center is open, other places have begun doing testing. It's now getting spread out more. So the availability is growing. We've been particularly fortunate here in Norwood. So you thank the folks at Norwood Hospital, and if you go to urgent care, I've been there several times myself, just thank them. Their overall level of preparedness throughout this has allowed us to be able to make sure that staff are getting, not just staff are getting tested, but that folks at the public health department have had tested positive, and they're folks that they need to quarantine. We've been particularly lucky here in Norwood, and they've both been relatively quick and easy about it. The hospital's done their inside operation, their outside operation, and I did not go to urgent care when I got tested. I went to Norwood Hospital, but my understanding is urgent care has been very good and very quick and easy about folks getting tested when they need to get tested if there's an order from public health or a doctor. So we've been particularly lucky about that. That testing is going to need to become normalized, and it's going to need to be on a wide scale before we can fully reopen the economy, but I think that that's coming. I think the governor's decision to open a huge contact tracing center is a brilliant idea. That's one of those items that's going to let us get back to normal faster than I think other states, because what you're likely to see is people are going to test positive, and then the numbers are going to come down. And as you reopen elements of society, you're going to see more interaction, and then that test number is going to go up, and then it'll come down. But your ability to do what our health department in Norwood has been doing here since March 6th, and the incredible job is to get in touch with everyone right away, do your quarantines, get tests if needed, and then sort of close that loop. It's been we've done incredible here, and I think the state's making the right decision with that, at least based on what we're seeing here at the local level. And other questions folks have. I mean, we're really here to try to answer any questions and get as much information out. I'll scroll through this quickly and see if I missed any questions. I do apologize. Last time I know I missed a couple of questions. NPS educators and staff are doing a great job. I heard that from a parent today who was also thrilled with overall their response. I think everyone's doing a great job and doing the best they can do given everything that's given the challenge. Also, a shout out to our mask makers in Norwood. There's a group making masks in Norwood that have literally made thousands of masks and got them out to folks, and that's been a big help. Do we have enough test kits for testing the potential COVID-19 patients as we're approaching the peak? So the town, that's a good question. We just discussed it. The town itself doesn't we don't have test kits. The municipality doesn't test individuals. It's all done through the Hospital and Urgent Care. My understanding is they have not had a supply issue there. So globally, there's a problem. Here in Norwood, we have been well served so far without any issues with the number of tests available. I don't think anywhere there's that number of tests available so that anyone who wants one can just go get one at any time they want. They're still trying to limit it. But if you remember, there was a time when you could only test people who had either tested positive or come into close contact with somebody and were required to quarantine by public health. Now they've set up a secondary station in Foxborough where first responders and essential workers can get tested. So the availability of testing is growing, but we have been blessed in Norwood. There's not been a time that Norwood Hospital or Urgent Care hasn't had tests available. So that's a great question. Doris Dixon, will this be available for replay? Yes, we save these and keep them on the town's Facebook page. So as long as Facebook doesn't go out of business, we believe they'll be available for the foreseeable future. Other questions folks have. It's a great question about the testing capacity. I myself have been tested a couple of times. It's not that unpleasant. It's just a quick nasal swab. So if you do, unfortunately, do we have any updates on MCAS for middle schoolers? I do not directly on the middle schoolers. I can get that back to you. I do believe the state, I believe they've exempted students from taking the MCAS, but I'll check with the superintendent on that. I don't know if they're doing it just for the 10th grade. I believe they've waived it for a requirement. So if it's middle schoolers who are taking their 8th grade test, I'm not sure if they're going to have them take it online or if they're just going to waive it for the year. But we'll be able to get an answer on that, and we'll post it right here as well. While folks come up with a few more questions, we still have some time here. I just want to reiterate for anyone joining us, you can call our call center. It's open 8 to 4. 781-352-2363. Call with any questions or any needs you have, and we will get you an answer. You get to call and talk to a live person. We have translator services available, and we just got a comment from an educator. The state has officially canceled the MCAS for this year, 3 to 10. So that is the answer to that one. I know they had waived the graduation requirement for this year's 10th graders. What are you doing for fun when you're off duty, and what services or opportunities are in the town for people to use in distress? What sort of mental health is there for residents during this time? Great question. So what am I doing for fun when I'm off duty? The answer is I'm unfortunately almost never off duty. I get up in the morning and I come into the office a straight 6 days a week, and then I try to take a little time off on Sunday in which case I try to take a nap or watch TV or spend time with friends and loved ones. So I don't actually get all that much time off. I have not, I think I had a half a day off on Easter, and that's the most I've had off since I think March 2nd. So I'm not a great example of what to do. I hear there's a lot of great trails out there and there's a lot of great walking paths out there. I'd love to do them if I got the chance to, but we are posting every Thursday our maps. I really encourage you to, yep, Doris, I'll talk about the election and the town meeting in just a minute. That's a great question. We'll be posting those online, and we'll be getting them out to people. We have a great trail network in town. As the weather gets nicer, I encourage people, take a walk around town, walk around neighborhoods you haven't walked around before. We have a beautiful town, beautiful houses and lawns, and it's nice to see your neighbors and see people in town. Keep your distance, of course. The track at the high school is still open. We'd like to keep it that way as long as people don't overload it and people don't spend time on the field and they just use the track. There's a lot of people watching a lot of series on Netflix. I like to read when I have time. I haven't had a chance to read lately, but the library actually has some great services. They're doing some story times for kids, and you can actually download books to your Kindle through the library at no cost through their Hoopla system. So check out all the programming available at the Morrill Memorial Library. They're doing a great job. The rec department's putting out some content as well. So there's some options out there. A lot of it is unfortunately digital. Full disclosure, I'm a giant Star Trek fan. If I had plenty of time right now, I'd probably be rewatching, one series or another, for the time. In terms of mental health, let me just scroll up and make sure I fully answer this question. What services or opportunities are there in the town for people who to use to de-stress? Oh, okay, sorry, to de-stress. I read that. So again, our trail network is phenomenal. Our trails committee has done an incredible job of getting maps of our trails printed up. We'll, if we don't have them up on the website, we'll get them up on the website, and we'll get them out to folks. There are a lot of hiking trails in Norwood, and I encourage you to take advantage of them. There's more nature in this beautiful little town of ours than most people realize. You can go out, you can walk, you can run, you can jog, you can do yoga from your yard. I think a lot of those things are great. If I had the time, I'd get back into running or jogging and using the trail network. The track at the high school is open. Mental health assistance is there available for residents during these times. We have Impact Norwood, we just posted the link, has some, oh, just real quick, Sunday Fun Day is also what I'm doing to de-stress. On a Sunday, go to Daddy's Dairy, get a giant sundae, tag it as Sunday Fun Day when you post it online. That's actually the one thing I generally look forward to every week is my weekly sundae at Daddy's Dairy. There's a link in the comments for what Impact Norwood, which is our substance abuse coalition, has put a lot of information out there about mental health and ways to stay healthy during this. If you go to their website, there's links to other other services that are available. We do have something known as Interface, which is a mental health referral service. They can help you get assistance. We have some other call lines. We have access on our citizen information guide, which is on our website, for the suicide prevention line, for the Good Samaritans, a lot of different resources out there that you can call if you're having trouble with mental health assistance. You can also call our call center and they can connect you with resources and connect you with either a counselor or some other sort of individual who can help you, or some resources as well. In terms of the election and town meeting, the election has been postponed as of now to June 8th and town meeting till I believe June 22nd. I'll start with town meeting because that's a little bit easier to discuss how we're going to do that, and then we'll talk about what we're calling a no-touch election. So the goal this year with town meeting, with the warrant, both our special and our annual, that's when we come together every year and approve the budget and approve spending and approve land use and bylaw changes. We're trimming the warrant down to be the bare minimum. And the reason is, assuming we still are going to meet in late June for town meeting, we've got to get at least 150 people into a room to vote. If we have to do that, if we don't, the state's looking at the possibility of doing that digitally. We could possibly delay it till June. There is till July. There is the possibility of that. But if we have to get that many people into a room, we want it to be as quick and as orderly as possible. We're putting all of our land use changes off until the fall. We're putting bylaw changes and other small items that normal sort of course of business to the fall. We're kicking most of our capital plan off to the fall. Now, part of that's for financially. We want to make sure we're keeping a big enough cash reserve to keep people on, keep services going. But it's also because if we don't have to do it in June, we don't want to do it in June. If we have to get that many people into the room, we want it to go as quick and orderly as possible. The formal budget should be out in the next week or two. We're going to ask town meeting members to review it, get us questions. We'll get them questions. We'll do some digital budget forums, everything we can do to get as much information out there and as much questions asked as possible. So if we have to have that many people in a room practicing physical distancing, it's as quick and orderly as possible, so it's as safe as possible. We're going to have to spread people out. We're going to have to make sure there's PPE available, but we just want it to be as quick as possible. We'll take up, when we're in a better situation, we'll take up the bylaw changes and the land use changes and the capital plan and all the other stuff that we always have fun with at town meeting in the fall. We're going to be looking at doing video recordings ahead of time for any of the reports that normally get done, so it's less time that many people have to spend in a room together in June when we know we'll still be coming on the outer end of this. In terms of the election, we're preparing for what we're calling a no-touch election. Now, we'll get in the comments the information about voting absentee. You can always do that. As of right now, the election is scheduled June 8th. It's always possible that could change. Again, a lot of these dates are based on the information that we have, and the state could come out and ask that we change it, and they'd have to make some legal or some legislative changes for that to happen. But we're planning on a June 8th election. It's going to be a no-touch election. We're going to have PPE. We're going to request people or recommend they wear PPE, but we'll have a mask and gloves available for everyone. We'll have sanitizer stations set up. You'll be given your mask and gloves in your own personal pen as you come in a little Ziploc baggie. And we'll have sanitizer available. We're going to ask everyone to sanitize their hands before they go in. You'll go in when you normally go to the table where the wonderful election workers ask for your address. You'll tell them your address. There'll be sort of a plastic shield, if you will, so there's no real contact. Ballot will go under the sort of under the plastic shield. You'll vote like normal. Janitorial staff will come over and sanitize the workstation or the voting stations after every use. You'll go up to the exit station. There'll be a plastic shield there. Same thing. You'll put your ballot into the ballot box. You put your ballot in, go to the exit station, and check out. And then you'll probably walk out a different way. We'll have barrels and recycling bins as appropriate for you to dispose of your PPE. But it is a no-touch election. It's been a lot of work so far. We're going to continue to do it. We're going to reach out to the League of Women Voters and have a discussion with them on their thoughts about it as sort of a neutral arbiter of elections and all things civic. And we are confident we'll be able to pull it off, and we'll be able to make people feel comfortable that if you come to vote on June 8th, it will be safe and it will also be efficient. And we want to make sure everyone votes. You can vote absentee, but we want you to feel safe coming to vote on June 8th. So it will be a no-touch election. We've already started in this week for the no-touch election. And it's going to end up being a little more costly than a normal election, but that's fine. We're going to spend what we have to spend and do what we have to do to make sure that people feel safe and comfortable coming in to vote, because we want people to come in to vote. Vote absentee if you can, but we certainly want people to feel comfortable voting. You are welcome, Patty Bailey, one of our great library employees offering a lot of services at the library. Watch Picard. I have watched the first episode and have been dying to get back into it. Not that we're here to talk about my choices of shows, but I've been dying to have some time to sit down and watch it. Norwood Rec is doing a lot of great stuff. We have the free databases at the library. I think date night for Sunday Fun Day is great. How are we preparing for, great question, triple E viruses on this season? We have been in contact. We do our regular aerial spraying, if you will. And some of the schedule of that has been rearranged, but we will be doing the same aerial spraying we do every year to ensure that we don't have a triple E season any worse than normal. We certainly don't want to be dealing with a pandemic and triple E, but we are going to be going ahead as time permits with a regular schedule for our aerial larvicide spraying for triple E. That's a great question. Recently listed, we are one of the highest COVID towns. What is the source the state is using to obtain these numbers? Is it the same source Norwood uses? Great question. We had that come up earlier, and I'll give you the shortened version of that. So the number we release that you see on our website, on the Board of Health's website, is we did that on Friday. The state released their numbers as of Wednesday, and the numbers are as of the day before. So the state's numbers were just a couple days ahead of ours. We released ours on Friday. They, the following Wednesday, followed up on it. So we're now going to just go with the state and let them release that on Wednesday. It's one less item for our staff to do. So that's why their number was higher. It was accurate as of the day before. Ours was accurate as of the day before we released it. In terms of our numbers being higher, in brief, and we talked about this at the beginning of the video, density, socioeconomic factors. We also have 4 nursing homes and 2 assisted living facilities totaling 665 beds in town. And unfortunately, that is a huge number of nursing home beds, and it's unfortunate that, and it's not unfortunate that we have nursing homes in town. Those populations are particularly high hit. A significant portion of our numbers are nursing home related, and that's of course unfortunate. It's a very susceptible population and a very susceptible type of building or type of operation. We also have been very aggressive in our contact tracing, getting to everyone within 24 hours and being very aggressive with people when they need to get tested. Myself as an example, I had a slight cough and the public health nurse said, you need to go get tested. I said, well, you know, does it really meet the requirements here? I'm the town manager. Do I really have to do what you say? And she pointed that thermometer right at me and said, you go get your test or else. And I went and got my test because I was a little afraid of her, but she's a great public health nurse. So we've been very aggressive in doing that, which is one of the reasons our numbers are higher, as well as Norwood Hospital and Urgent Care have been doing testing for quite a while. So their availability of testing also led to us being able to get more people tested as well. So we do use the same source for those numbers. It's just when we pull it versus when the state pulls it. And when a case goes into that system, it could happen at any time of day. So right now you could pull the numbers and you have to go in and manually count them. It's a frustrating process. And we don't want to distract the public health staff from that contact tracing to do it. So that's why we'd started doing it once a week. But now that the state's going to do it, we're grateful that they're taking that burden off us. But if you went in right now, it might say 252 cases, and then you could go in an hour later and it could be 262, or nothing could happen. It could be up 1. So that's more or less why we, in brief, why our numbers are bigger. If you, we'll keep the video posted. If you go back to the beginning, I give a little bit more of a detailed explanation. You can feel free to send us a message, or we can get it out there. But it's the nursing homes, socioeconomic factors, the density, and the prevalence of nursing homes and nursing beds in town, as well as the availability of testing and the great work our public health department has been doing, getting that contact tracing done in under 24 hours. And really being aggressive about when we're telling contacts that they should go get tested. So great question. Other questions folks have? We generally have been pegging these about an hour. I'm willing to stay and continue to answer questions. I'll do one more brief record of a repeat of some of the resources we have available for everyone. It's closed currently, but our call center is open 8 to 4, Monday through Friday. 781-352-2363. Please call us with any questions, comments, concerns, any issues you're having, access to resources. We're helping people get referred to unemployment and referred to SNAP benefits. We have some ability to do direct assistance for residents as needed on a case-by-case basis. So please consider reaching out to us if you need anything at all or you have any questions. You will talk to a real person and they will get back to you. And we have we have translator services available. A quick question: do we need prescription for COVID-19 testing? Your doctor can order the testing, or the public health department will if you have been either tested positive or you've come into contact with somebody who has tested positive, the public health department will ask to get that done, and you contact the hospital. Your doctor can ask for you to have a test done. They're generally only doing that if you've been symptomatic. What nobody has the resources to do is just test everyone who wants to get tested because they're curious. And I know that everyone feels that way. I have members of my family calling me saying, gee, how do I get a test? And I said, well, I don't know. You got to come into contact with somebody or test positive, or have your doctor order it if you're showing symptoms. But the other thing is you need to remember a test is a snapshot in time. So if somebody was concerned and they went out and got tested today and they tested negative, anytime you come into an interaction with any other human being, you're possibly going to be able to catch the virus. So I know some folks would feel good about getting tested once, but it's possible to happen anytime. If you've had symptoms and you think you've been exposed, either contact your primary care doctor, or you can always contact the public health department. I feel confident at some point society will have testing available for at any time, and once we get there, it'll be a lot more available. Thank you, Kate, for all you do for the town and for what your husband does for the town. He's one of our great volunteers, and we appreciate that. We appreciate you joining us. I'm going to talk a little bit about the Norwood Fund. We have our high quality information here. So we are asking folks for donations. There's a lot the town can do through our emergency expenditure processes in providing services. But if you can donate to the Norwood Fund, the money goes to seniors, veterans, folks having struggle with utility assistance, and food security. Is there an age range for the tested positive? I don't know if we have that on we have that. I think the state releases that data. I don't know if we have it on a local data. It's generally trending older along with state and national numbers. But if you could donate to the Norwood Fund, you can do it through our website. It allows us to provide some of those immediate assistance where somebody maybe isn't able to get SNAP benefits right away. They're not able to get another unemployment right away, and it's the quickest and easiest way for us to get help to residents. And it all goes through runs through the town's books. It stays in those donation accounts. We get audited regularly. We only can use donations for the intended purpose, which is those funds. And it's really a great way to let us help people quicker and easier, and things that we can do with donations that we couldn't necessarily do otherwise. So the age range, just to jump back to that, it's generally trending older, which is what we're seeing everywhere. Katie Bunny for Easter. Well, we don't know who was the Easter Bunny. I think it was the actual Easter Bunny here in town a few weeks ago. But the Easter Bunny did do a great job working with the rec department on visiting a lot of families and being out there. So great work on for the Easter Bunny. All right. Do folks have other questions? We've talked about the call center. We've talked about the Norwood Fund. We're looking to expand the call center hours, hopefully next week or the week after. We're just waiting to get some more technology up and running. And as somebody had asked, it's all being done remotely. We have one trunk line that dials a series of town phones that people have at their home. So everyone's actually doing the call center from home. And some staff were coming into the office and sort of doing double duty as well. One last plug for the Norwood Public Schools Family Food Drive. This is the beginning of our alternate food or secondary food pantry that we're setting up, starting it for families with kids in the school system, and then it'll expand from there. You can drop off on Friday. We have this on the website. I know it's a little tough to read off my printed number there, but we are asking you to donate if you can those items. Even if you can bring 1 box or 10 boxes, it's all very helpful. Other questions, comments, and we're going to do this next week too. So we're going to do this every Thursday at 4 for the at least for the duration of the state of emergency until we're on the other side of this. Our Board of Selectmen meeting remotely. My understanding is their next meeting will be remotely. It's will be a remote meeting. That's what I've heard from Chairman Bishop, and I think we're going to be able to make that happen. They're one of the more complicated boards to meet remotely because of the public hearing requirement and the public hearing process that they have to have and the posting requirements. It's a little bit more challenging for them than other boards. They've been doing great with the physical distancing when they have had a meet in person, but I believe they're going to try this week with their first remote meeting. They'll make sure to take appropriate measures if they're not able to. They're just a little bit more complicated than most boards because of timing and the hearing notice requirements that sometimes they have to be several weeks ahead of time. It's a little bit more complicated, but we're getting things lined up and we're getting the technology in place. And I believe it's Chairman Bishop's desire that this next meeting be a remote meeting. It's a great question. I believe planning and sustainability have met remotely. Conservation's meeting remotely next week, and a few other boards have. The school committee was first out the gate with that, and they did great with it. All right. I'll stay on for just a couple more minutes if anyone does have any questions, but if not, and I'll just be here. I want to thank everyone for joining us. We got positive feedback on this last week. Let us know what you think about doing this. We're committed to continuing to do it every week through the state of emergency. Continue to send in questions, and we'll continue to get resources out there, and we'll continue to get folks whatever services they need. So I'll close with, and I'll stay here for a few moments if folks have questions. Thanks to everyone that's out there working, the grocery store workers, the nursing home workers, the hospital workers, our staff, police, fire, public works, Norwood Light, all the town hall staff, the rec and the library staff who are bringing services to us remotely, our janitors who are still working, all the teachers out there who upended education and figured out how to do it inside a couple of days and are doing a great job with it. And a special shout out to interior workers out there who are feeding thousands and thousands of students in Norwood and elsewhere. They also launched this week a family dinner program. So once again, they've been doing breakfast and lunches for 100 years, and we said, can you do dinners for people who need them? And they pulled it off, and they did it. We gave 250 of those out, and so far it's been positive feedback. Let us know how these things are working if you did partake in it. And with that, I just wish everyone a good day. I hope everyone had a good Easter. To anyone who celebrates the Orthodox Easter, I hope you have a great Easter this coming Sunday. We'll continue to do this every Thursday. I will stay here for just a couple of minutes if anyone has any other questions. If not, I hope everyone has a great night. And if you're able to, go grab takeout from one of our many great restaurants in Norwood. Thanks, everyone. You can always email questions to norwoodma, managers@norwoodma.gov, and we'll answer them either in live time or we'll answer them in real time next week. All right. With that, everyone, I guess we'll go ahead and sign off. So thanks, everyone, for joining us, and I hope everyone has a great day.